To our keynote. Our keynote speaker today and our guest of honor is Natasha Poirier. Natasha is not going to be able to be with us this morning. She's not feeling well, but she has all of our absolute best wishes. And we're very fortunate to have Kelly Van Buskirk, her lawyer, who's going to share a bit of her story with us. But we really want to keep the focus on Natasha today. So I'm going to continue with the introduction that I was going to use for Natasha because we want to keep her with us and front and center in our conversation this morning. So Natasha shares her story of to expose issues of violence, promote mental health awareness, and spread awareness of the ways abuse and violence disproportionately affects the lives of women. She believes these issues go beyond just legal justice, but also extend to the pursuit of social justice. As I've said, she really wanted to be here today, but is just not able to. Kelly Van Buskirk is a longtime friend of Respectful Workplaces Week, and he'll be familiar to many of you from previous appearances here. Kelly, thank you so much for joining us. Kelly is going to be in conversation with Nicole Smith. Nicole is a workplace investigator and qualified mediator with Nicole Smith Conflict Management, but many of you will also know her as one of the longtime organizers and hosts of Respectful Workplace Week over the last few years. So Natasha Poirier is a registered nurse from New Brunswick, specializing in mental health and nurse management with an extensive 28-year career in nursing. Her journey spans various sectors from private industry and self-employment to government agencies and contract work. Throughout, she's been an ardent advocate for change within the healthcare system. After experiencing a violent attack in the workplace, Natasha began a difficult journey to pursue justice and healing. In May 2024, she published a book titled Unsure, Bearing Witness to Justice. In it, she details her harrowing experience as well as a pattern of both violence and silence in the healthcare industry. Speaking of her book, Natasha says, "Embarking on this literary journey serves a profound purpose for me. My decision to share my personal narrative is rooted in a desire to inspire readers to unearth their voices, surmount challenges, and always recognize that solidarity prevails even in the darkest moments." The urgent message resounding through these pages is clear. Violence has no place in the workplace, and we must collectively declare that it is an occupational hazard. This is a pervasive issue, a global epidemic that demands attention. Healthcare professionals deserve safe working environments, and the time to say enough is enough has arrived. Nicole and Kelly, I'll turn it over to you.
Thanks, Michelle.
Thank you so much, Michelle. And I want to start by saying I listened to Natasha's book via audiobook this last week. And not only is it beautifully written, but it's a very frank and genuine retelling of her experiences that at the same time still ends up being quite optimistic at the end. There's a real optimism at the end about her own recovery and about using this experience to bring change to the experience into the workplaces of the healthcare employees. So I want to thank Kelly for being here today to speak to us on Natasha's behalf. So for those who are unfamiliar with Natasha's story, Kelly, could you give us a brief summary of her experience?
Sure, Nicole, thanks. Natasha, as many people know, is a longtime healthcare professional, a nurse, and in March of 2019, she was physically attacked by the husband of a patient in the George Dumont Hospital. That attacker's name has become notorious here in New Brunswick, and essentially the attacker was angry because he felt that his wife should be in a different and quieter hospital room. He went to see Natasha in her office. She was working as a nurse manager at that time, and this individual became irritated. He effectively ended up assaulting Natasha, grabbing her by the hair, swinging her around in the office by her hair, kicking her. It was quite a lengthy physical attack, and it brought attention to this issue of workplace violence for obvious reasons. Behind that issue, though, was the impact that this attack had on Natasha. And to your point, Nicole, she speaks about it in her book, but she's also spoken about this impact and the many different impacts, actually, of the attack, both in court and outside of courtrooms. It's quite devastating, really.
And from my understanding, that impact has really sidelined her career.
That's correct. Yeah. I think Natasha, went from being a person who was highly active, like so many other people, highly interested in her profession. She was the kind of person who sought out improvement opportunities, professional education and development opportunities, and was a very hard worker. I would say that she still is, but she's unable to work at the same capacity that she could before this all took place.
Mm-hmm. One thing that is certainly evident when reading through the book, and then also as when speaking to Natasha, is that the pursuit of justice following this, as Michelle described it, this harrowing physical attack, that pursuit of justice became really a cornerstone for her.
I think so, right? I think that's one of the the really interesting and admirable attributes of Natasha, and there are many, but I think that Natasha felt strongly, and for good reason, that this was a sort of tip of the iceberg. Her case was one of many. We know that statistically, somewhere in the range of 9 out of 10 nurses are subjected to physical assaults in their workplace. And so for Natasha, it just happened to be the case that this one was of the kind that it ended up being obviously life-altering and so severe that she needed to tell this story to bring attention and to try to help curb what has become an epidemic.
Mm-hmm. I think that one of the reasons it's become a story that people publicly know, in a way that a lot of times those other experiences that nurses are having are not publicly known, is because of the court case, because there was an assault charge for the perpetrator, there was jail time for the perpetrator, and all of that made it very public. And so in a lot of ways, this one experience shifted it from, or that pursuit of justice shifted it from a workplace incident that's just dealt with in the workplace into something that was dealt with in a more public sphere. But certainly there's so much of this that's happening in nursing in their workplaces. What kinds of supports, what kinds of supports are there for someone like Natasha who experiences this in their workplace?
Right. Well, first, I would say that Natasha writes in her book about the legal processes that she has been through, and continues to go through. To your point, there was a criminal case, and there's an interesting book written by a professor at Dalhousie Law School, Elaine Craig, about the way that court cases victimize or can be problematic for the victims of assault, sexual assault. And so Natasha's gone through that. And then there was a civil case in her situation as well, which was very successful in the legal sense of the word, but it's again a traumatic experience for for an individual, because anyone who has participated in the legal system will know that it comes with lots of uncertainty. It comes with lots of stress, strain. Um, it's it's not a very private affair, and so for someone like Natasha to go through those two cases and have her proverbial laundry hung up on the line for the whole public to see, it takes courage, but it also takes its toll on a person's psyche. And then she had a third case as well, which involved her workplace per se. So from a legal perspective, Nicole, I would say that, sometimes people gravely overestimate the, the skill of the legal system to appropriately deal with issues, especially issues like this. I think the legal system is really good at dealing with particular issues, especially if they deal with, transactional kinds of circumstances. But this kind of circumstance is a tough one. It's a service that the public provides, but that service is a difficult one for victims. Then there, so there's that pursuit of justice part. And then, there is all of the physical and psychological damage that comes from being, being assaulted in this way. Natasha outlines this again in her book. There's no secret to it. In the civil law case, all of that evidence was demonstrated. And, we're fortunate in one sense, because in Canada, our Medicare system really does provide a lot of supports that might not otherwise be available. And so that's one aspect. There has been the need for treatment by doctors, dentists, psychologists, psychiatrists, physiotherapists, so many different needs. And so that's something that a victim has to consider, because we all forget this, don't we? Or I shouldn't say we all do, but sometimes some of us do forget that just the chasing around of the services is exhausting and frustrating, because the service that one needs might not always be available, or available as quickly as one should have it. In Natasha's case, there's also a workers' compensation element, and I would point that out, that if a person is injured in their workplace, then there is the question of workers' compensation, and an individual who seeks out workers' compensation will have to consider whether or not they want to elect to take the case out of the workers' compensation realm, or keep it in the realm, and have their case assigned over to them for pursuit in the civil courts by the WorkSafe New Brunswick people. There's a bit of complication to that too, Nicole. So all of these things, in my mind, really weigh on individuals, and I think it's pretty, it's pretty daunting, frankly.
I know in reading the book, or in listening to the book, correct me if I'm wrong, so the assault was in 2019, correct?
Correct.
And so the final verdict of the workplace related case only came out earlier this year. So in the book, Natasha talks about the time it took for the assault charge case to go through, the time it then took for the civil case to go through. And she talks about the burden of needing to pursue certain put in certain claims or certain cases at certain times, needing to manage all of that, as you said, on top of the medical ramifications of the assault, I think it's important for the audience, for the participants to understand this assault was extreme. It was very serious. It led to a significant number of physical injuries for Natasha, talking about broken fingers that have needed to have persistent physiotherapy for continued use, talking about a broken nose that led to a deviated septum that's needed to have surgery, a head injury that originally led to concussion that has since led to debilitating headaches, and vision impairment, which is needed to have special therapies, and all of this in conjunction with the PTSD that comes along with that, the brain fog, the struggles to have the energy to participate in all these processes, the struggle to feel safe leaving home, the struggle to feel safe in a workplace, right? How do you continue to go back to the hospital where you were assaulted for medical appointments? It's it's really, I think, one of the things that I found most um, difficult and also really vital and necessary in her book is how honest she is about all of that. Because I think it's really important that we understand that. And so I certainly take your point about, here is someone who has experienced this very incredibly difficult situation and then has to continue to function through these very lasting realities of it. Oftentimes, I think we think once the court cases are done, the situation's done, and everyone moves on. And Natasha is continuing to deal with it as she is continuing to struggle with the medical ramifications of it and to find herself a place professionally and personally to have purpose moving forward.
Yeah, and that's a good point as well that people in the audience will understand, because I'm sure the entire audience has committed themselves to one profession or another. And so everyone in the audience can appreciate all of the investment of time and resources that they have made, for their professional careers. And when that's taken away in an instant by a stranger, effectively,
Mhm.
it's really hard to, deal with that. I think that's one of the things that I find fascinating and troubling, and something that people need to be constantly reminding themselves of, that like the legal system doesn't really seek to answer that hole. It doesn't seek to fill the hole that you lose when your career is decimated. There and I guess the argument is that the legal system can't fill that hole. I suppose that's debatable, but what's not debatable is it doesn't really try to do that. And so for someone who's been, assaulted in the workplace and ends up with all of those conditions that you just described, I suppose there's this, magnified feeling of loss, because I think there could be a sense that nobody really hears what it is that you're experiencing. So
Yeah, because the court case obviously, I mean, Natasha has had to be on the stand for the civil and the criminal court cases, but that experience is not anyone saying, "Tell us how you're doing." That's not an experience of anyone saying, "How has this been for you? What's the impact? How can we help?" That's an experience of people picking apart her story in an attempt to understand the facts of the situation, which is not a closure. It does not bring closure for anyone.
yeah, I think there's some truth to that. I think, the courts um, have improved over time in terms of wanting to hear some of the, ongoing impacts. In the criminal context, there is a victim impact statement
Mm.
provided, and in the civil context, there is the opportunity to talk about the future. Um, but but again, from our legal perspectives point of view, it's hard, isn't it, for anyone to really quantify the extent of a loss like the one that Natasha Poirier's experienced. And so I think what that does is lead to some frustration too, because you know, I think that if you've suffered that degree of a loss, and if the people around you can't really articulate it, because they probably can't fully understand it, then I have to think that that's, you know, that in itself is devastating.
Yeah, and for the audience, so Natasha talks in her book about it's not that she doesn't want to go back to nursing. I think if she was able, physically able, Natasha would be back nursing now. You know, she talks in her book about you know, one of her first attempts to go back into the workplace, because she's tried a couple of times. One of her first attempts, she had been working and done specialized training in working with veterans with PTSD as a nurse, doing that nursing. And here she is as someone who now has and will continue to have this deep PTSD herself, trying to move back into that work with them, trying to support them. One of the things she makes very clear in her book is the reason she isn't able to go back into the field is because it has such a serious physical toll on her. She talks about even trying to do that part-time work and seeing 3 clients, you know, 3 veterans one day was leading to her having 5 days or, you know, where she was physically exhausted and couldn't really participate in the rest of her life. And so would have sort of one day or day and a half between working and exhaustion that she could actually, you know, enjoy her life. And so just physically not being able to have the energy or the stamina to be in the workplace in that way.
Right, right.
We
I think it's a good reminder, in my own mind at least, that for anyone who is in a circumstance like Natasha's circumstance, we hope that they will have coworkers who are, you know, really making diligent efforts to be understanding and to work to accommodate and to
Mhm.
facilitate as much, you know, recovery and as much, you know, return to work as possible. So I think that's, you know, that's something that we can all be reminded about.
Yeah, that actually leads to a great question we have here from the audience. So the question is, from a workplace or respectful workplace perspective, did her employer have her back and did her colleagues have her back? And how can colleagues support a teammate who's going through something like this?
Yeah, I mean, I shouldn't comment on her circumstance directly, but what I would say is that in a workplace where someone has a disability, especially one, you know, that is caused by the workplace or arises in the workplace, a better way to put it, I think we can all give some consideration to how we address that. Um, you know, if you're working with someone who has a disability, part of what we should all strive to do is to empathize in the strongest way we can. I did training with a lawyer years ago, Nicole, in the US. His name's Jerry Spence. And some people of the right age who remember the O.J. Simpson trial would remember Jerry Spence. He used to talk about crawling into the hide of the injured person. And we've all heard that expressed in different ways, like walking a mile in someone else's shoes. But he used to actually do this through psychodrama, which would mean acting out the limitations that this person had. So if you could imagine doing that with somebody, you know, like Natasha, acting out her disabilities and how they might affect you, it would give all of us a much more clear perspective on how she's living every day and the struggles she faces, and that would make us much better coworkers, right?
I think that's a very true and very real point. One thing I see a lot in my work is as you know, people are bringing me into workplaces that have different levels of conflict. There is often conflict around someone who has accommodations for a disability or for an illness, or who've experienced loss in their life and are now given an accommodation to try to do a progressive return to work. There is that can cause conflict amongst your coworkers. And I think there needs to be a real deep empathy there from colleagues about how that coworker is experiencing their workplace coming back from something. Um, one question in a general way then is, what do you think workplaces can do to support employees who've experienced violence in their workplace?
Yeah, Nicole, Natasha mentions this in her book, but first of all, there's the question of how people are treated when they bring forward a complaint, and I think that is in itself an issue that every workplace should consider, every manager should consider. Um, Sometimes we are all susceptible to thinking that the complaint is difficult to reconcile with reason or whatever the case might be. I think that workplaces can do more to make sure that someone who brings forward a complaint is treated with dignity and respect. Their complaint may not be accurate, but they can be treated with dignity and respect because of the fact that they perceive a complaint. The second thing is every workplace can have a rigid, structured response to complaints, whether those are complaints of harassment or of violence. And Regulation 91-191 under the Occupational Health and Safety Act really prescribes what the code of conduct should say in each workplace. So I think, that's a second thing people can do. Third thing is not just have a policy, but implement it. And on that point, here's something that struck me the other day because I was involved in a fire drill. And, I thought it's interesting that we have fire drills. I don't think we have any sort of complaint drills. In other words, I don't think anybody really practices what to do when a complaint arises. And we could probably benefit if we did do that.
That's a great point. It's never, I was giving training one day in an employer's office, and we had to pause our training on their harassment policy to leave the building for a fire drill. And I've never thought of it that way, that it's something that we should be getting people who receive complaints to practice, because that level of empathy, that level of dignity, as you said, when someone's coming to you with a complaint, it's not that the individual doesn't want to give it. It's often that they're shocked, that they don't know what to do, that they feel uncertain, that they're uncomfortable. Maybe they've come up through a profession that has a code of silence. And I think that one of the things that Natasha's story really exemplifies is that code of silence is incredibly dangerous. She talks about there being a code of silence in nursing so that people aren't coming forward with these complaints, or if they are coming forward to their employer, the complaints are being, pushed to the side, dismissed, sort of told to go away, ignored. And as a result, things, there was a complaint about the perpetrator previously that wasn't addressed. And now, it escalates and Natasha's the one experiencing it. So that ability for people to know what to do in the moment when they're receiving a complaint, because these complaints range, right? They range everything from, I feel uncomfortable with this coworker, to I've been assaulted in my office. And if we can handle them when they're down here, if we take care of things when they're down here, if employees trust that they're protected at this level, things will hopefully not reach that level.
Yeah, that's a great point. And a lot of times it's really just a matter of, I think, discussion, keeping in mind that we're all susceptible to biases. And so anyone who's in the position to receive complaints or to receive expressions of concern in a workplace should self-check on their own biases to make sure that, they're able to actually respond in a meaningful and thorough way to the complaint. It might not be the response that the complainant wants to get, but the more important point is it has to be a response that fosters safety and well-being for everyone.
Yeah, thank you. We have an interesting question here from the audience. Can you make suggestions around dealing with confidentiality and privacy while helping coworkers understand that a complaint has been made? What are healthy and appropriate boundaries? So if you have something like what Natasha experienced, where Natasha's assault happened in the workplace during the workday, it wasn't in the evening when the floor was empty of other nurses or other colleagues, other allied health professionals. This was an assault that happened in the middle of the day while there were people around the office when those individuals who finally heard and understood what was happening intervened physically. So here's a workplace that has had many people experience, at least tangentially experience what's happened. And now it's being, managed externally and internally. That question comes up a lot. How do you communicate to the rest of the individuals in that workplace while managing the confidentiality and privacy?
Yeah, I think that's one of the toughest questions. It seems to me that first there is a complication in the law around an individual who requires accommodation. To what extent is confidentiality and privacy extended? My sense is that employers do have to work on the premise that medical information is confidential, that circumstances, some circumstances that give rise to a medical condition are confidential. But interestingly, there are differing views on this here in Canada. Under the Canada Labor Code, for example, when a workplace investigation is completed, whether it be with regard to harassment or with regard to violence, the complainant, let's call it that, it's not really described that way in the legislation, but the complainant and the respondent and the Joint Occupational Health and Safety Committee all receive the report of the investigator. Whereas here in New Brunswick, under the provincial jurisdiction, and in most provincial jurisdictions across the country, that won't happen. So, I think there is room for employers to, be somewhat carefully creative in terms of how information about circumstances like harassment and violence are communicated amongst staff. I think the communication of medical information is obviously a no-no, and that's a confidentiality and privacy violation. So I don't envy employers having to deal with this.
No, it's really a very difficult, it's a really difficult balance they have to walk, or line they have to walk. I know in Natasha's book, she talks a lot about, or she talks some about the media coverage of the criminal and civil cases, and having her story put out there sort of without her control over how it was explained, how she was discussed. And so I think her book has been in some ways an effort to be able to tell her story from her own perspective, from her own point of view, which I think is really valuable. I also get the sense that she felt an ability to communicate what she wanted to tell to her coworkers, and felt a real support from them, that she had a sense of support amongst her colleagues and from the NBNU, which is the New Brunswick Nurses Union, from their the Canadian level nursing union, that she felt a lot of support there. And I think that telling her story has given her some space to open up to the public and to the community at large about what she's experienced. So
Yeah.
I wanna just say, as we're continuing this conversation, we're at 10:44. We've got about 11 minutes left. Please feel free to open up what other questions you may have, audience folks, that you haven't put forward yet. Sorry about that, Kelly.
That's great.
So the one question I'd like to ask you about is something that Natasha mentions at the end of her book. She talks about changes to the legislation that protect nursing. Now that's come, and as I understand it from the book, that's come as in some ways from this case. But how sort of how does that play out in New Brunswick? Does that exist now? That she talked about changing legislation so that nurses and assaults against nurses have the same weight as an assault against a peace officer or a police officer.
Yeah, I think that's an ongoing issue, really, that has to be constantly considered. We as a province, but not just New Brunswick, any province has to really evaluate how nurses are protected in the workplace. And I think legislative changes can help, but a lot of that has to do with education too. We can't forget that nurses are in a position where there is a lot of emotion. In Natasha's case, the attacker was somebody who was emotionally charged for reasons that we can all probably relate to, but it's a question of, regulating the behavior. And I think one of the best opportunities that exists for every workplace is to continue to heighten the power of observation. Like, it seems to me that in a hospital setting, for example, there are people who get the chance to observe patients or relatives of patients who are escalating. And the question is, do we have enough in the form of resources that can address those escalations in real time before they become an assault or before they become a violent situation? I'm thinking that that's a real opportunity in the healthcare setting specifically, right? So, in other
Focusing on
workplaces,
prevention.
I think so. And, like in other workplaces, it's a bit different. Like in the, there's some really good statistical data around what kinds of occupations are most susceptible to violence in the workplace. And, like overnight clerks in hotels, for example, they have a like statistically high prevalence of being subjected to, robberies and being held at knife point or gunpoint. So there are steps that employers can take then to reduce or mitigate those kinds of risks. It can be as simple as just protocols concerning the locking of doors. Convenience store clerks, right? Remember, there was a day when you could go to the convenience store at midnight and the door would be unlocked.
Yeah.
Not so likely now. And those are all good, positive steps, but they come as a consequence of people evaluating safety risks in workplaces.
Yeah, it's interesting you say that because Natasha in her book talks about she worked at a federal prison before she moved into community nursing, as she was doing when she experienced her assault. So she had been working in high risk, in actually the highest risk sort of medical unit in the prison she was working in. And so she talked in her book about the many safety protocols in place there, the many steps that existed to note behavior, to note elements that would turn the kinds of things that would lead to an escalation in violence, to bring in to have emergency safety buttons, to have locked doors, to have security brought in when there was a need. And so, yes, in thinking about that, having some of that, obviously to a less extreme extent, but having some of that transferred to a community nursing environment. Now you go to a clinic and the doors between the waiting room and the clinic are locked, right? That space you have to be let into that space. It certainly raises the question then about what, those regulations from WorkSafe that talked about increasing workplace harassment protections also talked about workplace violence protections and having risk assessments to prevent, to do that preventative work around violence. So have you seen a movement in workplaces towards doing those risk assessments, towards putting in preventative plans?
I would say, in my own experience, some workplaces have done that. And some workplaces have been they've been very dogmatic about, doing the most they can for the safety of their employees. Others not at all, really. And so I think that's another opportunity for employers, because first, it's a requirement under the legislation now. Second, it's such a sensible thing to do.
Mhm.
You know, when I hear employers talking about, gee, we're having difficulty getting trained workers and all the rest, the old rule, the 80-20 rule says, well, why not focus on the people who are doing 80% of the work now and keep them safe so they can keep doing it? That would be a lot of, I think that would be a sensible thing. To an earlier point you made, Nicole, like, just in terms of dealing with the possibility of a violence issue, even if you don't go into the sort of physical realm of your space, even if you separate the risk assessment from the physical aspects to the psychological aspects, I wonder how many employers teach their employees de-escalation training. Like,
Mhm.
the famous hostage negotiator, Chris Voss, talks about labeling emotions, negative emotions, and the science behind that, which is that it will often reduce or, de-escalate the emotion. Do people do that kind of thing? Do they train their staff members on that? I think those are opportunities that may not be fully utilized right now.
I really agree. We have a question, about de-escalation here from an audience member, and they're talking about teaching people managers de-escalation so that they are able to assist their employees who are getting emotionally heightened, or situations that are emotionally heightened, in a way that is effective, instead of almost expecting a people manager to bring that skill naturally, and then there's the risk of them not knowing what to do and doing something that escalates the situation.
Yeah, I think that's a great point. I think there are lots of sort of training programs on this. I mentioned Chris Voss just because he's on the top of my mind right now. Um, he talks about the use of labeling. Um, this is easily accessible material, and it's easy to do, by the way, because all of us have had this done to us, right? Where you're frustrated, let's say at a store because something, some product hasn't come in yet or hasn't, it broke or whatever the
Mhm.
case is, and you're frustrated. And a really good store manager will say, look, it sounds to me like you're very frustrated with us right now. That is in itself scientifically a way to bring the temperature of the discussion down. It's such an easy thing to do, isn't it? But I'm not sure, to your audience members' point, I'm not sure how many people are actually making use of those training opportunities.
My sense, I think, is that there's so many pressures, there's so many pieces of work that are being put on people managers that often they're not being given the opportunity to learn how to be people managers. They maybe feel like there's no time to do those trainings, or their employer is not encouraging those trainings. Their employers are focusing on KPIs instead of on whether or not your employees feel supported. Your employees feel like they can go to you. And oftentimes when I'm going into a workplace where there's conflict, my first steps are coaching those people managers to deal with their employees who are in conflict, because they don't feel like they know how. And I think de-escalation is a piece of that for sure.
If I could add to that, Nicole, because I think another real opportunity in workplaces, and I've been dealing with some large workplaces in different areas on this. There's a lot of focus on managerial training. Um, Follower training is a great thing for people to consider too. There's a book written by two Harvard law instructors, Sheila Heen and Doug Stone, and it's called Thanks for the Feedback. And I think it's absolutely brilliant, because one of the problems in workplaces today is that people are often incapable of taking feedback. It's nothing personal. It is not harassment that you're being told that you're not doing your job. Like that, you know, in and of itself is not harassment, but it's very frequently perceived as harassment because people don't have the skill set to deal with receiving feedback. So I thought Heen and Stone did a great service to write this book called Thanks for the Feedback. And I think that's another opportunity that employers can think about. Very cost effective. I think that it heightens productivity and it reduces the prospect of harassment complaints as well.
I really appreciate that recommendation for a book because I love one of my absolute favorite conflict management books that I've experienced, I've come across in my profession is by Heen and Stone and Patton, one of their colleagues, called Difficult Conversations. And it's
Right.
really focused on how to have those emotionally vulnerable conversations in relationships. But this sounds like it really takes that and focuses on the workplace. And I think that's really, I'm going to go out and pick it up. So thank you for that. We're at 10:56. I want to say thank you so much, Kelly, for coming and doing this. Reading Natasha's book and understanding her story was really something that was important to me coming into this Respectful Workplace Week. It has touched to me, it's so touching to realize that not only has she experienced this, but that she's now taking that experience and really trying to use it as a way to improve workplaces and workplace safety for nurses moving forward, for healthcare professionals moving forward. So thank you so much for coming and speaking on Natasha's behalf because she wasn't able to be with us today. We really appreciate it.
No, thanks, Nicole. And to everybody in the audience, I've had the real good fortune of getting to know Natasha Poirier. I think you can through her book. And as Nicole says, I think her story is really something that all of us should familiarize ourselves with. So, Nicole, thanks for making sure that Natasha's story gets out there.
I want to hop on to say thank you to both of you for being here. This was a really great conversation. Not only, Natasha's story is so remarkable and being able to dig into it is such a privilege, but there's also so many themes in here that we're going to pick up on in different sessions that we're going to have over the rest of today, the rest of Respectful Workplace Week, things about difficult interactions with the public and its impact on recruitment and retention in these really important institutions and public services. The importance of workplace policies, the importance of enforcement, the importance of management that's prepared to actually act and follow through with skill. So thank you so much for that. This has been an absolutely wonderful start to the day. We're going to take about 2 minutes to just reset and get our next panel set up. Take a moment, grab a glass of water if you're sticking around. I hope you will. We're going to return at 11 a.m. with Work Harassment in the Public Eye with Sabrina Dellin from the Samara Center for Democracy and Peter Lagasse from the New Brunswick Teachers Association. I just wanted to say, we've noticed a couple people in the audience with hands up. We don't have a mechanism for responding to that. So just as a reminder, if you need to communicate with us at all, the team, for help or to talk to speakers, please use the Q&A function in the bottom. That'll come straight to us and we'll handle whatever is going on. Okay, so we're going to go quiet for about 2 minutes and we'll be back with Sabrina and Peter. Thank you, Nicole and Kelly. Take care.